Four-chamber view. Four-chamber view is the key plane for assessment of the fetal heart. The plane is a transaxial view of the fetal thorax. There are three types of four-chamber view. Apical four-chamber view, the apex is directed towards the transducer and the interventricular septum is aligned with insonation beam. Transverse four-chamber view, the interventricular septum is at 90 degrees angle with the beam. Optimal four-chamber view, the apex is directed at an acute angle of 45 degrees from the beam when the fetal spine is at the 6 o'clock position. Axiality check. The optimal axial cardiac orientation is confirmed by two criteria. One complete rib on each side of the thorax. The lungs are of equal size on both sides. Assignment of cardiac chambers following a clockwise direction from the sternospinal line. First, identify the descending thoracic aorta, located anterior and slightly to the left of the spine. Second, the morphologic left atrium is the chamber adjacent and anterior to the aorta with flapping foramen ovale. Third, the morphologic right ventricle is the cardiac chamber just below the sternum, with transverse moderator band at its apex. Checklist. First, 2/3 of the heart occupies the left hemithorax. Second, the cardiac apex is directed to the left of the midline, with 45 degrees cardiac axis, levocardia. Third, at least 2 of the 4 pulmonary veins draining into the left atrium. Fourth, the 2 atria are of similar size. Fifth, the flap of the foramen ovale opens into the left atrium. 6. Presence of the crux, with offset aspect of the 2 separate AV valves, with normal systolic and diastolic excursion. 7th, 2 separate atrioventricular valves, with normal systolic diastolic excursion and offset appearance where the septal leaflet of the tricuspid valve insertion is just below the septal leaflet of the mitral valve. 2 ventricles are of roughly similar diameter, with mild prevalence of the right one. 9th, the right ventricle is slightly wider and rounder because of the presence of the moderator band in its apical part. 10th, the left ventricle forms the cardiac apex. 11th, equal thickness of the free ventricular walls, with normal contractility and rhythm. 12th, intact interventricular septum.